In this video, here's what we'll cover: the two-way link between sleep and mental health, what poor sleep does to the brain, how different conditions disrupt sleep, CBT-I, the first-line treatment, sleep hygiene versus real sleep therapy. It is the middle of the night. The house is quiet, everyone else is asleep, and your mind simply will not switch off. You watch the clock tick past 2, then 3, and you start doing the maths on how little sleep you will get before the alarm. The harder you try to force it, the further away sleep seems to drift. If that sounds familiar, I want you to know something. You are not simply a bad sleeper, and this is not a small thing you should just put up with. In my practice, sleep comes up in almost every conversation. It is rare for me to sit with someone who is struggling with depression, anxiety, or stress and not find sleep tangled up somewhere in the picture. And yet so many people have quietly learned to live with it. In a world that treats rest as a luxury, poor sleep can start to feel like the price of a full life, rather than a health issue that deserves real attention. Let me start with the most important idea. The link between sleep and mental health runs in both directions. It is not simply that anxiety or depression steals your sleep. Poor sleep also feeds those conditions, and sometimes it comes first. Research shows that people with ongoing insomnia are 2 to 3 times more likely to develop depression than those who sleep well. The good news is that treating the sleep can lower that risk. Picture it as a loop. A bad night leaves you tired, flat, and short-fused the next day. Small stresses feel bigger. That heavier mood then makes the next night's sleep even harder, and around it goes. This is why, in many cases, treating the sleep directly, rather than waiting for everything else to settle first, can actually speed up recovery. So what is poor sleep doing to the brain? Quite a lot. As it turns out, sleep is not an off switch. While you rest, your brain is busy filing away memories, clearing out waste, and topping up the part at the front that handles calm, rational thinking. When sleep is cut short night after night, all of that suffers. One clear effect is on your emotions. After too little sleep, the brain's alarm center, the amygdala, becomes far more reactive, while the thinking part that usually keeps it in check goes quiet. Studies by the sleep scientist Matthew Walker found that sleep loss can amplify emotional reactivity by up to 60%. In plain terms, everything feels more raw and more threatening than it really is. Focus fades, decisions get harder, and for anyone already managing anxiety or low mood, that extra weight makes ordinary days genuinely difficult. Now, different conditions disrupt sleep in their own distinct ways, and knowing the pattern helps guide the treatment. In depression, about 3/4 of people report insomnia. A classic sign of melancholic depression is early morning waking, snapping awake at 3 or 4 in the morning with a racing, hopeless mind and no way back to sleep. Anxiety tends to hit the other end of the night. The nervous system stays switched on, in a state of hyperarousal, and the quiet dark becomes the perfect stage for a worried mind to run. With PTSD, nightmares and a constant sense of being on guard make it hard to feel safe enough to drift off. And in bipolar disorder, a sudden drop in the need for sleep, feeling rested after only a couple of hours, can be an early warning sign of a manic episode, which is why we watch sleep so closely there. This brings me to the treatment that has the strongest evidence behind it, and one many people have never heard of. It is called CBT-I, or Cognitive Behavioral Therapy for Insomnia. Major clinical guidelines now name it as the first-line treatment for long-term insomnia, ahead of sleeping pills. It works as well as medication in the short term, and its benefits last far longer, without the risk of dependence. CBT-I has a few core parts. Sleep restriction, which gently limits time in bed to rebuild a strong, natural sleep drive. Stimulus control, which retrains your brain to link the bed with sleep again, rather than with lying awake and frustrated. Cognitive work, where we gently test the anxious beliefs about sleep that keep you wired, like the fear that one bad night will ruin tomorrow. And a steady schedule, waking at the same time each day to anchor your body clock. Which leads to one last, important distinction. You have probably heard the usual advice: avoid screens, skip the late coffee, keep the room cool and dark. This is good advice, but on its own it is rarely enough for clinical insomnia. Sleep hygiene does not reach the two things that really keep insomnia going: the learned wakefulness in the body and the busy, monitoring mind at bedtime. That is the deeper work CBT-I is designed to do. If you have followed every sleep tip for months and still cannot rest, that is not a failure. It simply means it is time for the next, more targeted step. If poor sleep is wearing you down, especially alongside worry or low mood, please know that real, evidence-based help exists. At Potentialz Unlimited in Bella Vista, I weave sleep-focused work into treatment for anxiety, depression, and stress, in person or by telehealth. You can read the full guide, or book an appointment, using the links in the description below. Before you go, here's a quick recap of what we covered. The two-way link between sleep and mental health. What poor sleep does to the brain. How different conditions disrupt sleep. CBT-I, the first-line treatment. Sleep hygiene versus real sleep therapy.